Morning, everyone. Can you hear me? Okay. Thank you so much. My name is Kelsey Frahlich with Citizen Health. I was originally supposed to be Nasha Fitter, our co-founder and a wonderful, incredible, rare mom of a daughter with FOXG1 syndrome. Nasha was unfortunately able to make it today, so I have the great honor of filling in for her. So thank you so much for having me. My background is as my background is as a registered nurse in neurology and epilepsy, and I've been with Citizen Health for about 4 years now on the clinical data operations team, and specifically I lead our data abstraction. So what that means is my team is the team that's going through all of your medical records and abstracting pertinent clinical data points. And so at the risk of sounding maybe a little creepy, you don't know me, but I know you. I have read your stories, and every data point that our team abstracts represents a piece of that story and a piece of you. So I'm really honored to be here and put some faces to the names that I've been seeing for years, and excited to show you some of the things that Citizen's been working on. So I suspect most of you have heard of Citizen Health before, but I'll do a very brief overview of who we are. When you sign up for Citizen with your consent, we collect your medical records. They are immediately actionable from our AI advocate, which I'm going to talk about at the end here. But they will also be processed again through my team for natural history data. And that data can be shared again with your consent, de-identified for research purposes. This is a snapshot of a patient with MECP2 duplication syndrome, and it's really just to give you an idea of our data model. So kind of the key takeaway here is the longitudinality of our data. So you can see we have about 14 years of records for this patient from birth till age 14, and potentially even more than that. So some of the things that we look at on the clinical side are seizure burden, hospitalizations, medications, developmental milestones. So these are some of the things that we see. All right, next I'm going to give an update to the community on where we're at with Syngap on the Citizen platform. So we officially have 289 patients with SYNGAP1 on the Citizen platform. This is so exciting for us. This is one of our largest cohorts, and you guys were also our first partnership. And this year marks 5 years that we've been working with here at SYNGAP1. So this was an effort of many of you in this room. We obviously wouldn't have this number without your participation, so we're really excited about this. Specifically in 2025, we had 26 new signups on Citizen for SYNGAP1 patients. We uploaded over 200,000 new pages of medical records, and we also did $200,000 in revenue sharing back to patients across everyone on our platform, not just for SYNGAP1. And we also, this year, marked $1 million in revenue sharing back to patients of all time with Citizen. So, very exciting milestone. I'm going to dive into some Syngap-specific data that we're able to draw upon from the records on our platform. So this figure here it says common clinical phenotypes, but it's actually all of the clinical phenotypes that we have on our platform. The colors are broadly aligned with different bodily systems. So like that darker purple on the right is neurology, to the left of it is behavioral, and so on. The size of the bubble correlates to the percentage of patients in the cohort with that diagnosis. So the bigger the bubble, the more patients. And so you can see the big bubbles are probably the ones that I suspect they're resonating with you. We have global developmental delay, low muscle tone, epilepsy, sleep challenges, challenging behavior, autism, et cetera. These are sort of the things we think about when we think of SYNGAP1, or at least they're the ones that we talk about, right? But I actually kind of want to draw your attention to the smaller bubbles. So the smaller bubbles, the color is still aligned in that system, and these bubbles without labels are patients, we have less than 10 patients with that diagnosis. And I think that's important to mention because while we can make this pretty colorful figure, this is your life, right? This is your day-to-day. And there are many of you that are experiencing things in those smaller bubbles. And I think what Citizen aims to do one day is be able to connect patients in general, but especially in those smaller bubbles where you can reach out to people who don't have these as well-known phenotypes. So if we kind of zoom in on that figure a little bit, we are going to look at a specific patient's journey with SYNGAP1. On the bottom here, we have the patient age in years, so from 0 to 10. And then the purple diagnoses are the onset of these symptoms. So we can see this patient started with some developmental delays and hypotonia, had some vision changes, was diagnosed with epilepsy around 2.5. After that, started having some behavioral issues, maybe some autistic features, and even some more progression before they get the SYNGAP diagnosis around 4.5, and some progression after that as well. So the takeaway here, I think, again, is that longitudinality, but also just that we can kind of map out this journey for specific patients and the time that it correlates to. And also, SYNGAP and other DEEs are going to look different at different stages of life, so we can kind of start to chunk those things out. This is the same patient, but here we are looking at seizure burden over time. So again, on the x-axis on the bottom, we have the patient age in years. This middle chunk is showing seizure burden. So at the bottom, we have 0 seizures and all the way up to 5 or more. At the top, those purple lines is kind of our attempt of overlaying this data with overlaying our anti-seizure medication data with the seizure burden. And on the bottom, you can also see the number of unique anti-seizure medications that this patient was on every year. So I would love to be able to show you this graph and say, look, like more meds, less seizures, but I think we all know that's not the reality. So despite some polypharmacy, and I think ketogenic diet is represented here as well, this patient's seizure burden remains rather high. Okay, I'm going to transition away from the data and talk a little bit about Citizen Health's AI Advocate. I hope many of you have heard of it. I hope some of you have tried it out. We are still in our beta testing phase of our AI Advocate, so trying to get people to test it out and give us some feedback that we can incorporate and make a great tool for you all. So when your records come into Citizen, you can immediately start using the AI Advocate to ask questions, and it will draw on your medical records to answer those questions, as well as some cohort insights of patients that we have on the platform. Again, I am not Nasha Fitter. She is mom to Amara, who again has FOXG1 syndrome. So this is what Nasha sees when she logs into her Citizen platform for Amara. And I'm going to just walk you through a couple of the examples of how you can use our AI Advocate. So the first one is get ready for an upcoming appointment. And sorry, I'm going to go through 2 of these rather quickly, and then the last one we'll kind of pause on. But Nasha says she has an upcoming appointment with Amara's neurologist. What should she do? Sorry again about that. Okay. It's kind of balancing up here, so I apologize. And the AI Advocate lets her know what to bring and some targeted questions to ask. And again, this is based on what we know about Amara from many, many years of medical records, and also potentially previous things that Nasha has asked the AI Advocate. And so perhaps like where we left off in the records, if there was a recommendation to trial a medication, maybe she's going to follow up on that or something. The second example I have is to prepare for an insurance appeal. So Amara has a PPO and was denied for an adaptive bike, and the AI advocate actually writes the appeals letter for her. And I believe this number is correct, that we've already had 5 or so patients on our platform with successful appeals from this example. And lastly, this is the one I kind of want to focus on, explain FOXG1 syndrome to a friend. So Nasha asks this, it first spits out just some basic information on FOXG1 syndrome, ways people with FOXG1 communicate, families and caregivers, some advice there. And then it will actually generate this kind of one-pager on Amara. And not just Amara with FOXG1 syndrome, but Amara. You can see that the message on the bottom is see Amara first. FOXG1 syndrome is one part of her life, but she's curious, she likes music, she likes to look at pictures. And so I think it's really important to those of us at Citizen that are working on this, that it remains, I feel strange saying like human while I'm talking about this robot, but at least having that component. And so you can see it focuses on that, but it also gives some brief information, important information on what is FOXG1 and how does it affect Amara's daily life, how should you interact with Amara. So this is a really great thing to print out, give to people in your community, give to people who might be other caregivers, give to school teachers or baseball coaches and things like that. Here are a few testaments of real patients who have used the AI advocate. So we have the doctor's appointment example. It can generate summaries and timelines of when things happened, which I know is an incredible thing to have to remember on your own. We have people who use it for IEP prep, which is great, and just a game changer for some of these patients. And lastly, I'm hoping this next video works, of what's coming. We're still, like I said, this is our first iteration of the AI advocate, so there's features we want to add in, and we, again, would love your feedback on what would be helpful for you as families. That's the most important thing. We're building this for you. But if this video works. Okay. Working. Okay, so this patient, or sorry, this caregiver is saying, our physician recommended a feeding tube for our daughter with Rett. What do you think about that? And so you can see the AI is looking through the medical records, but it's also now looking through answers from other patients and caregivers. It's looking through journal entries and other sources. So right now it's just medical records, and we want to add on these other features to the platform that can inform the AI as well. So it spits out some things, and Nasha clicks on the journal entries, and so we see, this example isn't Nasha, but this parent clicks on the journal entries, and you can see there's some answers from other rare parents that are giving some recommendations or some experience with the feeding tube. All right, and that is Citizen Health. And if anyone has any questions, we're going to hang around for a little bit after. If you're not signed up for Citizen Health, I very much encourage you to do so. I don't know if I have time for any questions, but I'm happy to now, or I'll be sitting over there if anybody has any questions.